Diabetes. Diabetes mellitus is a metabolic disease in which a person has high blood sugar, either because the pancreas does not produce enough insulin or because cells do not respond to the insulin that is produced. The role of insulin. Insulin is a hormone that comes from the pancreas, a gland located behind and below the stomach. It is produced by special cells known as beta cells. The pancreas secretes insulin into the bloodstream. The insulin circulates, enabling sugar or glucose to enter the cells. Insulin lowers the amount of sugar in the bloodstream. The role of glucose. Glucose, or sugar, is a main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Liver stores glucose as glycogen. When insulin levels are low, the liver converts stored glycogen into glucose to keep sugar levels within a normal range. Most common types of diabetes include type 1, type 2, and gestational diabetes present during pregnancy. Type 1 diabetes, also known as juvenile diabetes or insulin-dependent diabetes. It's a chronic condition in which the pancreas produces little or no insulin. Typically appears during childhood or adolescence, but also can develop in adults. In type 1 diabetes, there is no insulin to let glucose into the cells. Therefore, sugar builds up in the bloodstream where it can cause life-threatening complications. Cause is unknown. It's an autoimmune condition when body's own immune system mistakenly destroys the insulin-producing cells in the pancreas. Genetics may play a role in this process, as well as exposure to certain viruses may trigger the disease. Symptoms include polyuria, frequent urination, polydipsia, excessive thirst, polyphagia, extreme hunger or excessive appetite, weight loss, blurred vision, fatigue, acetone breath, and hyperventilation. Type 2 diabetes, also known as non-insulin dependent diabetes or adult onset diabetes, is more common in adults. In type 2 diabetes, the islet cells are still functioning, but the body becomes resistant to insulin, or the pancreas doesn't produce enough insulin, or both. Body does not use insulin properly, which is known as insulin resistance. As a result, blood sugar does not get into the cells to be stored for energy, causing high level of sugar in blood, known as hyperglycemia. Cause is unknown. However, the risk factors include obesity, physical inactivity, genetic predisposition, and race. Symptoms include the three classic polys: polyuria, polydipsia, polyphagia, weight loss, blurred vision, fatigue, dry itchy skin, peripheral neuropathy, numb or tingling hands or feet, recurrent vaginal infections, and slow healing wounds. Long-term high blood sugar levels can have negative effects on the entire body and its functions. Long-term complications of diabetes that develop gradually include cardiovascular disease such as coronary artery disease, stroke, nerve damage, kidney damage, eye damage known as diabetic retinopathy, foot damage, and skin conditions. Diagnosis includes the presence of signs and symptoms as well as test results. Tests for type 1 and type 2 diabetes include hemoglobin A1C test. This test indicates the average blood sugar level for the past 2 to 3 months. Fasting plasma glucose test, oral glucose tolerance test. A blood sugar level over 126 milligram deciliter for fasting test and above 200 milligram deciliter for oral glucose test indicates diabetes. Despite active research, diabetes has no cure, although it can be managed. Both types 1 and 2 are chronic conditions that cannot be cured at this time. The goal of treatment at first is to lower the high blood glucose levels. An important part of managing all types of diabetes is maintaining a healthy weight through a healthy diet and exercise plan. If diet and exercise do not stabilize sugar normal levels, medications may be prescribed. The word diabetes comes from ancient Greek, which literally means a pass through with the intended meaning excessive discharge of urine, composed of prefix dia, meaning through, and betes, meaning to go. The word mellitus comes from Latin word mellitus, meaning honey. Mellitus was added to the word diabetes as a designation for the disease indicating urine of diabetic has a sweet taste, glucose urea.